Hi, my name's Christy, and I'm presenting a case on an 8-year-old female today referred to us by her PCP after receiving scores back from a voluntary participation that this child had with an autism research project. After looking at the scores, he is considering that her diagnosis very well may be autism rather than the ADHD he has been treating her for. She is accompanied today by her biological mother, who reports she began seeing these symptoms at age 2, and she is now currently in 2nd grade and is homeschooled by her mother due to the behaviors. When she's overstimulated, she begins screaming, having meltdowns, hitting herself, flapping her hands, and flipping her ears. She wears noise-canceling headphones in an attempt to prevent these overstimulations from occurring. She is affectionate towards her parents. However, she is very aloof and cold to strangers. She will only talk excessively about cats and plushies, which are an obsession of hers that she has learned much about. She is currently taking Vyvanse 20 milligrams once a day, and this has had no improvement in her behavior. Her review of systems and her examination show no physical abnormalities. Her vital signs are within normal limits, and she's in the 8th percentile for her height and the 3rd percentile for her weight. Her family history is unremarkable except for her sister, who is 13 and is showing signs of depression and anxiety for the last year. On the testing from the Autism Research Project, her Wechsler Abbreviated Scale of Intelligence was 108, which is in the average range for intelligence. And on the Autism Diagnostic Observation Schedule, she had an overall score of 117, which is very consistent. And she did show that she met most of the criteria for autism spectrum disorder. So at this point, her differential diagnoses have been ADHD inattentive type or ADHD combined type, and considering autism spectrum disorder. After reviewing her behavior today, the testing results, and the reports from her mother and PCP, we feel like the most likely diagnosis would be F84.0, which is autism spectrum disorder, as she does meet the full criteria of this disorder. The plan moving forward for this patient is to gradually discontinue her Vyvanse, as it has shown no improvement, and leave her off of medication at this point. The family was giving multiple resources. We made a referral for PT for her gait and mobility and OT for her fine motor skills. They were provided resources for parents such as Autism Tennessee, Triad, and Autism Speaks. She will follow up with this office in 6 weeks. Thank you.